With the increased success of our program and many others like ours at Marian, we have seen an increased volume of complex surgical cases. This increase has in turn placed a demand on resources in the operating room. We need to expand the operating room facilities both in size and in number to continue to support the mission of the hospital. We have strong leadership that has provided the guidance and vision on how we can serve our community best. We've added additional providers like myself and our physician assistants to so many great existing providers and surgeons who provide outstanding care day in and day out. Now we need to update the facilities to fulfill that vision to its full potential. The operating rooms at Marian are small and they're outdated. And although I don't know the exact date of when these operating rooms were constructed, it's my understanding that the rooms are about 30 years old, if not more. Think back 30 years and how much the world has changed in that time. In May of 1992, the World Wide Web, although it had been invented, was not yet available to the public. You've Got Mail was not yet a thing. Amazon was just a river and rainforest in South America, and the only Snoop Dogg anyone knew about was Charlie Brown's friend in the comic strip Peanuts. Now think about how much the operating room has changed in the last 30 years. On the first page, you can see a very outdated operating room. Now this is not Marian Regional Medical Center, but a room like this might have been used to perform procedures at a time when current equipment wasn't yet invented. Additional space was not needed because procedures were only done with instruments that the surgeon could hold in their hands. The next picture is an example of what a lot of current up-to-date operating rooms look like in 2022. There are monitors to help relay information to the surgical and nursing teams during the procedure, and there's much more space to accommodate additional equipment. The next photo is an example of what a typical orthopedic trauma room looks like. Again, there's more space to allow for larger beds that allow us to give the ability to pull traction on infected arms or legs to restore proper alignment. We have enough space to fit our fluoroscopy unit and its corresponding monitor that allows us to take x-rays during the procedure. There's also plenty of room for the back table or two to organize many trays of equipment needed to perform these procedures. Next, on page 4, there are several photos of one of the current rooms at Marian Hospital where we're currently performing many orthopedic trauma procedures. You'll notice a lack of space and how little maneuvering room you have with all the equipment in there. There's a picture of the C-arm that we use to take pictures of the x-ray. That machine is quite bulky, and with that machine in the room, it allows for little space for the nurse or other assisting staff to help with the surgery. There are a few different views of how that looks when you're working in the room. Obviously, it feels very cramped and claustrophobic. Sometimes the table reaches almost to the end of the room where our circulating nurse has to duck under the table to move it around in order to take care of patients properly. On one of the pages, you see a computer monitor. This is the nursing station where a nurse sits in order to take care of the patient. Oftentimes during a surgery, the nurse will need to access the patient and climb around monitors and under tables in order to get to the patient to check a Foley catheter or positioning of an extremity. And on the last page, there's a picture of the OR table. In this particular room, there's really only room for one table. Oftentimes during our procedures, we use 2 or more tables to handle all the equipment necessary, which causes issues with sterility in a very crowded room. Last but not least, sometimes because of the cramped space, we have to take some of the equipment that should be in the operating room and stick it in the hallway in order to maintain enough space to do the procedure. So, as you can see, we are in need of an upgrade. I hope that I've conveyed how overdue this project is and how necessary this project is. The Surgical Service Expansion Project will increase the size of our operating rooms and bring us one step closer to being on par with many other top medical centers across the country. Hospital leadership has made many critical moves to help provide more comprehensive care to our community. Now we're asking for your support to help us update and expand our operating rooms so we continue to grow and provide the best care for our community. I thank you again for the invitation to be your speaker today, and thank you for taking the time to listen about our project. Thank you.